I'm Lynn Blackstone. I'm the CEO and founder of Easy Diagnostics. In 2009, my daughter nearly died from the H1N1 flu virus. She was in a coma and on life support for 2 weeks. She was in intensive care for 6 weeks, and she was hospitalized for over 2 months. She nearly died because her diagnosis took days rather than hours. Easy Diagnostics is developing rapid tests to deliver results in just minutes, so clinicians can begin treatment sooner. When you think about clinical diagnostics today, it's painfully difficult and costly for all of us. We go to a doctor, he does an exam, and routinely orders lab tests. We then often have to go to a different location for a blood draw. And if you've ever not followed through on that, you're actually not alone. 30 to 50% of us are no-shows. Why? Because it's so inconvenient. And that's a big deal, because 80% of the objective data in your health record and mine are lab tests. So we have this significant amount of missing data. But let's say that we do follow through. We have our blood drawn. It's then transported in a vehicle to a central lab where it's processed. The data is uploaded to the lab's computers and is sent back to the physician's office, where we often begin this telephone tag with the nurse to learn what the results are. And sometimes to schedule another appointment with the doctor to discuss those results. Clinical lab testing today is this complex, confusing, and costly maze. But tomorrow, diagnostic testing will be an easy on-ramp toward healing. Easy diagnostic testing will be done in the exam room or in the field using a simple finger prick of blood and a palm-sized instrument. A disposable cartridge containing the blood will be inserted into the internet-connected device, and data will be uploaded to algorithms in the cloud. Rapid test results, payment, billing will all be automated for clinicians, patients, and insurance payers. Easy Diagnostics is following a predictable pathway of disruptive innovation. The pathway is pretty typical. What was once difficult becomes easy. What was once far away at a central lab becomes close by, in the exam room, at a retail store, or even in your own home. Let me give you a couple of examples of that pathway. Some of us may remember when film photography was sent to a faraway central lab called Kodak. But today, testing is in the palm of your hand. Some may remember, who are even older, when data processing was far away at a central mainframe computer. But today, the personal computer industry has changed all that and disrupted an entire industry. So we no longer have to wait for results. Tomorrow, diagnostic testing will be like that. We will no longer have that painful waiting for results. If you're an investor and interested in the potential for a double bottom line, an opportunity to help heal millions and at the same time receive a financial return, I encourage you to learn more about the vision and plans of Easy Diagnostics on this website. If you feel like we might be a fit for your goals, please reach out to me. I'm Lynn Blackstone, and I wish for you the best.